Hello, everyone, and welcome to CharmHealth's Tech Tuesday at 10 series. We're excited to start this series. Every month, you'll get about 45 minutes of a single topic of Charm, one of Charm's features, and it's a great opportunity for our practices to join in and go deeper on some of the aspects of Charm and that they'd like to learn and ask questions, of our developers and our support staff, anything that you'd like to know. My name is Ranjani Rangan, and I'm in marketing here at Charm. And today here for the Charm Analytics webinar, we have Matt Techler, who will be presenting today. And on support and to answer your questions, we have our developer, Charm Analytics developer, as well as our support team manager, Samba, the Charm developer. Did I mention her name? Her name is Archana. So I'm really happy to have them join here today to be able to answer your questions. And I'm really excited to have Matt Techler presenting to you. With that, I'd like to pass the torch over to Matt.
All right. Yeah, thanks, Ranjani. My name is Matt Techler. I work on the sales team, and I'm going to be going through these different analytical reports. So from the homepage, if you want to get there, you'll just click on Analytics. That'll take you to the Analytics section. So I'm just going to go through all the reports here, explain what they do and why you can use them, both all the default reports and then some of your custom reports where you can change some of the different parameters. So we'll start with default reports. Encounters, these are pretty straightforward. This is just going to show you all your encounters for all your different facilities. So you can either filter it out with all facilities if you have multiple locations, or you can search a single facility location, and it's going to show you all your encounters. And if you click on it, one of the line graphs, it'll show you all the patients that came in for that month. And if you need to, you can export it as a spreadsheet, or you can bulk SMS text them. So this is more like we don't have email campaigns in the system. So this is the text campaign feature we have. So if you need, for marketing reasons, to text all the patients in a group, all these reports will have this SMS bulk text function. So that can be helpful if you need to reach out to patients to follow up with them for different reasons. So day, month, and then there's another one for visit types. So this will categorize all your different visit types that patients came in for. You can break it down by either the whole year, or you can do it by month. And it'll show you kind of the same thing. So all your different visit types. And if you click on one for a specific month, it'll show all those patients. You can export a spreadsheet or bulk text everyone in that group. You can also do it by appointment mode. So this will be in-person visit, your telehealth, video consult, or phone calls. So if you need to reach out to any of these patients, you can click on the graph and it'll show you all those patients that came in for that month. And then if you need to, you can also look at patients by provider. So you can see all your different providers, and you can see what how many visits that they're doing for either the year or for specific months. And if you click on their link, their graph, it'll show you all of those patients as well. And again, bulk text everyone or export into a spreadsheet. Next one is for patients by registration. So this is anytime you add new patients to your Charm account. Since we don't have an email campaign, what some people will use this for will be if you want to add, like each month, if you need to add all the patients to like a email campaign service like MailChimp or Constant Contact, each month you can come in here and just click on all of those patients that were added for the month, and you can export them, and then you can import those to your email campaign system if that's something you need to do. So that could be helpful for that reason. Patients by demographics. This actually has a lot of cool things in here. It just breaks up all your patients by all these different demographics. So if you wanted to look at all your patients in a certain age group and you wanted to reach out to them via text or another way, you can click on that different age group. That'll show all those patients in the age group. that you're in, and you can bulk text or export. There's different male, female, different gender, and then there's different states. So if you work with, maybe you work in telehealth and you operate in different states, and you want to reach out to those patients, you can click on the links and it'll show you all those patients in those different states. And then you can also does it by city. So if you want to target a certain city for marketing reasons, you can click on the link and it'll show you all those patients in that city. And again, you can text all those patients. There's a couple more down here. There's county as well. And then there's categories. So if you want to reach out to specific patients of a specific category, this is where you can click on the link here and it'll show all those patients in that category. And all the categories will be things that you can set up. So where these would be enabled would be under, if you go to any patient, and if you click on edit patient, there'll be their category. Category will be at the top here. So these are different categories that we created in here, but you can make all your own custom categories. You could do it for like maybe cash patients, first insurance patients, or whatever category you want to assign them. And when you assign them that category, they'll then be dumped into that different category report. So you can run reports here and other areas once you assign the patient that category. That could be helpful. Then a couple other ones are just blood group, language. So you can target specific languages of patients. And on all these, you click on them and it'll show the full list of all those patients, and you can text or export them. For source, this is another custom one. So this is like kind of where the patient found you. So this will be good to track like your different marketing efforts. So that will be set under this. If you go to a specific patient, there'll be, and you click edit patient, and you go to the bottom, there'll be, how did you hear about us? So there'll be a source, and it could be, newspaper, radio, search engine, whatever. And then you can also have a specific source, and you can track this later as well. So you can have New York Times or whatever. And once you set this up, you can then run different reports on, all your patients on like how they're finding out about you. And so that can be helpful for tracking your different marketing budgets. But this will just show you where all those patients are coming from. So once you set the source to patient, that's where this report is coming from. Those are all the demographics. Next one, we have PHR usage. So from here, this will show you all your patients that are either using the PHR or they're not using the PHR. So this is a good area if you need to send out a bunch of PHR invites to all your patients at one time. This is the fastest area to do that. You'll just click patients without PHR, and then it'll show you the full list here. And if you scroll over to the right, you'll see invite. So as long as all of these patients have associated emails, as long as you'll just click invite on all of them, and then it'll just send out patient portal invites to all those patients. You can do this individually from the patient. If you go to the patient's dashboard and PHR registration, this says resend because they already had one, but it'll say send if they don't have one. But the fastest way, if you need to get a bunch of them in, would be from this analytics PHR usage. And again, just click the patients without PHR, and you go scroll to the right and click invite, and it'll send all those invites out to all those patients. So that can be a helpful way to just get all your patients registered to the portal. Next couple ones here are, you can look at patients by primary care physician. So this won't necessarily be you, but this comes from, again, the patient's, if you go to patient's dashboard and you go to their care team, it'll be coming from here. So you can add different PCP providers in here. And once those get added, you can then track all the PCPs from this primary care physician report, and it'll show you all of those. And if you click on them, it'll just show all your patients that have that provider as their primary care provider. And you can bulk text them or export. Next one, kind of similar, you can track all your referring providers. And those are set in the same area. If you go to any patient's dashboard, care team, and referring provider. So same thing, if you set a referring provider here, then that patient will go onto this report under that referring provider. So you can see all referring providers and all their associated patients. Next item will be their in-house care team. So this will be set in the same area under in-house care team. And this will be providers that are working in your Charm account. So this can be a helpful report. So once this is set here, then you can see all the patients that are registered to all your specific providers that are on your Charm account. So as long as you add them in there, then this is a good way if you just need to track all patients for a specific provider. If they have to leave your practice, this is a good area to check. This is one area you can check that from. And you can export the full list of all their patients. So that's one use case for this report. Next one, we have primary insurance. So this is just going to show you all primary insurance for all the patients. So if you click on it, it's just going to show all patients for that specific payer. So if you need this, you can export these reports or mass text them. Next couple ones are pretty self-explanatory. It's just like your top 20 diagnosis codes, prescriptions, vaccines administered, lab tests, and supplements. So whatever your top 20 are for your whole practice, these reports will show those different items here. Next one will be your average time per status. And this is coming from your calendar. So if when you go to calendar and you're in your list view and you change the status of a patient here, like if you have them, checked in and then they move to checked out, it'll show like the time between each status that the patient is seeing with you. And then once you add those here, it should come over here into this report, show you that average time if that's something that you need to track. So I know some providers need to see, they track the time that they're seeing with the patient, and they have to bill them accordingly. So this can be an area you can track that in. Next, we have automated booking assistant. So this will tell you basically like how effective the automated booking assistant is working for your practice. So you can't, when you click on it, it doesn't show you those patients, but it's just going to tell you, if the patient was able to confirm their appointment. And this feature is through, you need to have text enabled to use this feature. So basically the patient will get texted an appointment reminder, and they can either confirm with you. They'll click, I forgot what the number is. I think it's 1 to confirm. And then that's where this response would come from. And then they could either reschedule. So they could, if they can't make your appointment, they can reschedule with you from text. And so they can reschedule or not reschedule and just basically cancel. So you can just see how effective that automated booking assistant is working for you from here. So that's the main reason you would use this report. Next one, we have patient feedback. So this one's pretty cool. You can make a custom feedback form, and this is where you can see all the responses from all your patients. So typically you would send this after the patient has come into your office, and you can just ask them different questions of, how their experience was with you in your practice. And it's going to show all their responses here. So so in this example, this type of question would be, you'll ask a question and then the patient will have a written out response. So you can see all the written out responses from all the patients. And then this one over here will be more like you'll ask a question and then there's different options that the patients can select. So you can have, what we're treated for, and then you can see the different treatment types, and all of these are customizable. So any questions you ask on here, you can configure what you want to ask them and what things you want to track. So this could be a cool area to track just different patient responses. And then another example is you can have a rating scale. So you can have like, how would you rate experience with us? And then you can see the different options here, and you can just get good feedback on from your patients here. And to build these out, if you want them, they'll be under settings. If you go to questionnaires, you'll do add new questionnaire, and then you'll just build it as the feedback form. So these will be all the components that you could use to build them out. So it's like question with open response, question with option, and then rating scale question. So through those, you can build out your feedback forms, and then all the patient responses will come back to this reporting section, and you can kind of see different feedback from all your patients. So this can be pretty helpful. So done with default reports, we're going to move on to custom reports. So here, these can be patient statistics. There's different reasons why you can run these. So if you want to look at like all patients in like a certain age group, you can set the age and then you'll click generate report and it'll show a list of all those patients. So just example. So you set age range, generate, and these are just going to export as a spreadsheet. So there isn't like a text option for these. So you can set your criteria to run these different reports. So age is one. And then you can check like all patients who are smoking or not. If you want to check the gender, patient category, you can also track in here. So if you have like, your cash patients, insurance, or whatever you want to track, you'll set the category to patients, and then you can run reports on all those specific categories. And then you can check, so provider and appointment, this can be helpful if you want to see all patients that have come in to see a specific provider for a certain date range. So also for a scenario, if you have a provider that's leaving your practice and they need to just tally up all the patients that they've seen, you'll just set the date range for that provider and then generate report. And this is going to generate the spreadsheet file of all the patients that provider had seen in the time range that you set. So this could be another report to help you out in that kind of scenario. And then we have the sources again, what we talked about earlier. So these you can search both source and specific source. So you can see basically how where your patients are coming from. So in this example, you could either do newspaper, and this would show like all newspapers. And then if you want to narrow it down, in this example, you could narrow it down to like just New York Times, and it'll show just those sources for you. So these are all customizable. They can just help you track to see where your patients are coming from and where they're finding you. So, and then at the bottom, medical history, if you need to track like all patients that have been diagnosed with certain DX codes in the past months, you can set this and it'll show you all those patients. Or you can see patients that have been, that you've given a certain medication for in the past X months, generate a report for that. So these are all customizable, and you can do multiple criteria at the same time if you need to narrow things down. So patient statistics. Next, we have patient follow-up. So this is if you want to look at, you haven't seen the patient come in to see you in the past maybe 3 months, and you want to see all of those patients. For those, you can do the bulk text. So this could be helpful if you haven't seen them in a couple months and you want to text them and remind them, hey, like maybe you can come back in for whatever reason, and you can type out your the bulk text that you want to send to them. So this would be helpful for marketing reasons to get your patients back in to your office. And there's also additional filters on here. So if you need to kind of narrow things down, you can exclude like the patients didn't come in for certain reasons. And it'll just narrow down the search if you don't want to search for patients that have come in for specific visit types. Or you can search them for patients that have come in for specific types of active diagnoses. So those can be helpful if you want to narrow it down a little bit. Patient follow-up. Next, we have recall report. So recalls will be if you need, you'll set them when you're in, one area is you can do it in the patient's dashboard. So if you go to patient, and then on the left side, you'll go to recalls. So you can add a recall for a specific patient. And a lot of the times it's just like you want the patient to come back in your office for a follow-up, and you want them to come in 4 weeks, and then you can have different reminders go out to them. So you can have email, text, or voice reminders go out to that patient, and you'll type in the reason why you want the patient to come back in. And once you add this, that'll then add the recall to that patient. And then you can, once you've added all your recalls to all your patients, you can then track all of them from here. And you can look at different statuses. So if you want to see like all pending recalls or all completed or whatever, you can search all of those, and you'll just set the date range you want to look at, and it'll show you, I think these. So you'll set your date and then generate, and it's going to show all those recalls that you've added and the different statuses. So that could be helpful, and you can do your bulk text on all of those recalls. So that's what that report will do. Next, we have patient insurance. So this can be helpful if you want to look, for patient's insurance that's expiring soon. You can check here and generate, and then it's going to show you when policies expire, or you can check the policies that have a prior authorization expiry coming up. So you can set these filters, and it's going to generate all of those patients in the criteria that you select. And for these, you can also send out the bulk text if you need to remind them, oh, like we need to get your updated insurance. So this could be a good way to mark it out to them to get those things updated, or get their prior auth updated if you need that. Next, we have the prescription report. So anytime you add a prescription, those prescriptions will come in here, and you can generate different reports in here. So you can look at controlled substance or just non-controlled. And it's going to show you all the drugs that have been prescribed, and a different transmission mode. So this is just if you need to look at that report, you can come here, and then you can look for just specific providers or all. So that's what this report will show, and you can bulk text for these guys, or you can export as a spreadsheet. Next, we have vaccinations. So if you need to track all patients who have had administered vaccinations in a date range, you'll set your date range, and you can generate that report. It'll show all the patients that have been vaccinated and what vaccines they came in for. And there's additional filters if you want to check like specific vaccines that have been administered, or who specific ordering providers, different ages. So you can filter these things out for vaccines, and it's just going to show you all the patients in that criteria that you set. Next one, we have lab orders. So anytime you add a lab order, you can generate report of all the labs that have been ordered for that date range that you set. And you can add additional criteria if you click this plus button. So if you want to check like a specific patient or a specific test or a provider, there's different criteria that you can select here to narrow things down. And you can bulk text again, or export all as a spreadsheet. Flow sheet report. These can be pretty cool. These are all customizable. They're pretty similar to vitals, but they can be added when you're in the chart note. And there's different, these are all customizable. So I think the one I mean, so you'll select, you can look at all your flow sheets, and you select your date range, and then it's going to show all, basically all responses for all the different flow sheets for that date range that you set. And you can look at just all the responses that you filled out. So if there's anything that you need to track over time, this is a good area to do that. And you can either do it for, let's see, you can either do it for all entries, or you can flag certain entries that you're documenting in flow sheets, and it's just going to show the flagged ones. So if you need to look at, this may be more for clinical studies, but if you want to track all flow sheets for all your patients, this would be a good area to see those. Next, we have implanted devices. So this would be if you go to your patient dashboard and you click the plus button up here, and you add your implanted devices. First, you'll have to add implant device. Once it's added to the patient, you can then track all your different patients that you have added implanted devices for. And then you can generate the different reports for those. So if you need that, this will be a good area to search those. Next, we have patient feedback. So this will be kind of the same report we looked at on the other report, but you can see all, let's set date range. You can just see all the responses that patients have filled out for their feedback with you. And in this case, there's just one, but this will show you kind of like the rating scale questions, or written out response, or what you were treated for. So there's different, this will just show you all responses for all the feedback they've gotten. And then you can do it for either specific providers or all of them, and it's just going to show all responses from everybody. So if you need to export those and put them in a different database, this would be a good place for that. And then last three, these would just be for all the different meaningful use reports. So for all of them, you're just going to set your provider and the date range, and you'll request the report. And once the report comes out, you can view it and you can see if that provider has met the goals that are required. So it'll tell you if it's satisfied or not based on what you've been documenting in Charm. So if you're not doing meaningful use, then don't worry about these ones. This is just for clinics that have to document all these different meaningful use metrics. So we have meaningful use report, we have the MIPS report. It's kind of same thing. You'll set your provider, date range, and request, and you can view if that provider has met all the goals. And then same thing for the CQM measures. You'll set your provider, date range, and you'll generate. And then this is going to generate the different reports of all the different metrics for the CQM report to see if that provider has met the different goals for those. And for this one, you can export this Cat3 report if you need that. But those are all the analytical reports. Hopefully, these things can be helpful for your practice for both marketing or just general tracking reasons. I'm going to let Samba take over to answer any questions that you have on any of these.
Thanks so much, Matt. Great presentation.
Thank you.
So do we have any questions from our audience? Samba can also take some of those questions live or also answer them. So Matt, I think you wanted to ask a question, so I'm going to go ahead and ask you to talk. Yes.
Okay.
Well, Matt, you can ask your question or comment,
Excellent.
whatever you'd like.
Are you all able to hear me?
Yes, we can.
Okay, cool. So I am the new CMO for Frontier Psychiatry, and I work with Reza, who I know has collaborated a lot with you all. So first of all, just great product. We've been really pleased with it. I've had experience across multiple different EHRs, and this is a great one. So we specifically had a question about whether or not there was a way to gain access to the raw database tables for our respective patients. And so I may have to explain that a little bit more, but basically, like at my previous work, we were able to download a CSV database that each row was an individual patient encounter, and the reason that that's helpful is that then we can use an analytics package, our own, and kind of customize what kind of questions we want to ask in real time. I didn't know if there was anything like that as far as getting the raw sort of unprocessed information, but I just thought I would ask.
Great question. Samba, would you like to take that, or Archana?
Yeah, so I'll take it up. So yeah, basically, like there is no access to the raw data. So whatever reports we generate for the patients or whatever analytics, only those things are available. Generally, chart notes, that information can be exported into CCDA format, okay, not the CSV. And in case you want any further, like any other information to be fetched, you can make use of our API program. So we are also offering APIs for each and every module. So based on your requirement, we can offer you the APIs. So using which you can extract the data from Charm database. That can be done.
Okay, cool. Yeah, so the reason that we're asking is we're a fast growing company. And so as we add new sites, it would be nice to be able to, pull the raw data, and then we can customize variables. For instance, if we've got, 10 hospitals and we grow to 15 hospitals, but those are all part of the same category, rather than still analyzing by site. If we have access to the raw data, then we can code for a new variable and then run our own analytics package. So I'll ask Reza to reach out to you guys and try to
Yes, yeah. So you can send out an email with your requirements so that we can send you details on what APIs are available and how you can use them.
Fantastic. Thank you so much, guys.
Yeah.
Wonderful. Thanks so much for the question.
Julie T had a question about, she asked, is there an extra charge to send a mass text to patients that are due for follow-up? There is extra charges. If you check our pricing, it'll be, it's 20 a month. And then if you go over 250, you'll be charged 8 cents for each additional text. So if you just go to our website, it'll show all the text fees. So those can add up depending on how many texts that you're giving out for all these mass text reports. And then if you're seeing yourself doing a lot of text, you may want to look at the provider plans. We have provider plans that are both $200 a month per provider and $350 a month per provider. And those two plans are either 1,000 texts per month included or 2,000 texts per month for both of those plans. So depending on how many texts you're doing, you may want to look at the different plans.
It looks like there's one more question that just came in. Is there a way to pull patient info into Excel for analysis? I don't see a way to do this from the available APIs.
Yeah, you wouldn't necessarily need the APIs. So if you just go to patients and export patients, this is going to export all patients to spreadsheet, CSV file if you need that. And then you could run that on Excel after this is exported. And then kind of like we reviewed in some of the other, if you need to filter things down, you can you look at your custom reports and you can export these as CSV files as well. So there's a couple ways you can do all or just filter out specific categories of patients if you need those.
All right. I think that would be it for our open questions. I hope this has been a fruitful session for all of you. Please come to our future sessions, and I think the next session is going to be on charm charting and templates. And I know there's a lot of questions regarding that. So please spread the news among your practice members if those are the people who are involved in those particular features. And if you have any suggestions for features that certain features that you'd like more in-depth training on, please send me an email to newsletter@charmhealth.com, and we can add that into our list. Well, thank you all, Matt, Samba, and Archana for joining, and thanks to everyone here. I appreciate your time.